Guidelines refer to a set of internationally recognized guidelines primarily developed for the management of acute cholangitis and cholecystitis. They were first introduced in 2007 and have undergone updates in 2013 and 2018 (TG18) to incorporate advancements in research, clinical evidence, and practices. Overview of the Tokyo Guidelines (TG). 1. Purpose: to standardize the diagnosis and management of acute cholangitis and cholecystitis, to improve outcomes by providing evidence-based recommendations, to offer criteria for grading the severity of these conditions and to guide treatment approaches accordingly. 2. Target conditions: acute cholangitis, a bacterial infection of the bile duct often secondary to obstruction, e.g., gallstones, tumors. Acute cholecystitis, inflammation of the gallbladder, frequently due to gallstones obstructing the cystic duct. 3. Scope: diagnostic criteria, severity assessment criteria, management strategies, including antibiotic use, drainage procedures, and surgical interventions. Key components of the Tokyo Guidelines. 1. Diagnostic criteria. The Tokyo Guidelines provide criteria for diagnosing acute cholangitis and cholecystitis based on clinical, laboratory, and imaging findings. Acute cholangitis: suspected diagnosis, clinical signs, fever, chills, or inflammatory response. Laboratory findings: elevated white blood cell count, CRP, or liver function tests, e.g., ALP, bilirubin. Imaging findings: evidence of biliary obstruction or dilation. Definitive diagnosis: combination of systemic inflammation, cholestasis, and imaging findings. Acute cholecystitis: suspected diagnosis, local signs, Murphy's sign, right upper quadrant pain, or tenderness. Systemic signs: fever, elevated inflammatory markers. Imaging findings: thickened gallbladder wall, pericholecystic fluid, or gallbladder distension. Definitive diagnosis: integration of clinical, laboratory, and imaging findings. 2. Severity assessment. The guidelines categorize severity into 3 grades, guiding the intensity of treatment. Grade 1, mild, minimal systemic signs, can be managed conservatively with antibiotics and supportive care. Grade 2, moderate, moderate systemic signs or organ dysfunction. Requires more aggressive treatment, including early drainage, e.g., endoscopic or percutaneous. Grade 3, severe, associated with organ failure, e.g., cardiovascular, renal, respiratory dysfunction. Requires intensive care and urgent biliary drainage or surgical intervention. MAMA 3, management strategies. Antibiotic therapy: empirical broad-spectrum antibiotics targeting common pathogens, e.g., E. coli, Klebsiella spp, Enterococcus spp. Tailoring antibiotics based on cultures and local resistance patterns. Biliary drainage, acute cholangitis. Early biliary drainage is critical for moderate to severe cases. Options include endoscopic retrograde cholangiopancreatography, ERCP, percutaneous transhepatic biliary drainage, PTBD, or surgical drainage. Surgical treatment. For acute cholecystitis, laparoscopic cholecystectomy is the standard. Timing: early cholecystectomy, performed within 72 hours for mild to moderate cases. Delayed cholecystectomy, for cases with high surgical risk or delayed presentation. Supportive care: intravenous fluids, pain management, and correction of electrolyte imbalances. Updates in the 2018 Tokyo Guidelines, TG18. Enhanced diagnostic criteria. More precise and simplified criteria for acute cholangitis and cholecystitis to improve early recognition. Antibiotic stewardship: emphasis on preventing overuse of antibiotics and tailoring treatments based on pathogen profiles. Technological advances: integration of newer diagnostic tools, e.g., EUS, MRCP, for more accurate imaging. Regional variations: adaptation of guidelines to account for local healthcare resources and bacterial resistance patterns. Clinical impact. The Tokyo Guidelines are widely accepted and used by clinicians globally. They have significantly improved patient outcomes by reducing diagnostic ambiguity, promoting timely and appropriate treatment, lowering mortality and morbidity associated with acute biliary infections. The Tokyo Guidelines continue to evolve as new evidence emerges, making them an essential resource for healthcare providers managing hepatobiliary diseases.